Hi, welcome to our phone-in. We want to hear from you about cancer diagnosis and treatment in the NHS today. What's your experience? Call us on 03700 100 444. 03700 100 444. The BBC's health team has been analysing which hospital trusts are the fastest and slowest for diagnosing and treating cancer in England. Across the UK over the past few years, no country has been meeting the target. The patient should wait no more than 62 days, 2 months, from their cancer referral being received to starting treatment. What's happened to you? What is your experience of cancer diagnosis and treatment in the NHS? Here's that number again, 03700 100 444. Let's go straight to our callers. Angela's on the line. She is in Surrey. Angela, tell us, what is your experience of this?
Well, my experience was with my daughter, Winifred. She was ill. This is way back in 2022. She began feeling ill. So the problem started even before she was diagnosed, in delays. And she was feeling ill in the stomach and was therefore being treated for indigestion by the GP. But unfortunately, she never managed to see a GP face to face. And although she'd asked for an endoscopy, she didn't reach the criteria through the GP. Apparently she hadn't lost enough weight to be referred on. So we paid privately for an endoscopy, and it found that she got stage 4 cancer.
Oh, I'm so sorry. An endoscopy, a camera into her stomach to have a look?
Yes.
Yeah, I'm so sorry to hear that.
Oh, thank you. From then on, she was referred not to the local cancer care hospital, because it was actually going through a crisis and internal investigations. So she was referred to another local hospital for possible oncology, but also for possible surgery. She was referred to a hospital in Surrey. So she was actually being treated diagnosed then, between three different hospitals, in fact, even more than that. And it really did get very chaotic. The communications were muddled. The treatment was disjointed. There were delays, unnecessary delays, because of communication problems, and sometimes even opposing views from the different hospital trusts on what should be the next stage and what should be the next treatment. And unfortunately, there were times when communication was so poor that she was told by one hospital that the scan that she'd had showed a complete response, which actually means that there's no sign of cancer.
Was this after surgery or chemotherapy? What treatment did she have?
After both, yes. And, we were all jubilant about that, of course. But some weeks later, so she was actually told then she didn't need any more chemotherapy. But then some weeks later, the other hospital who actually carried out the surgery analysed the same scan and found that it had been misread previously.
Oh, I'm so sorry.
And that it had spread, and therefore she did need to continue chemotherapy. Well, all that took a long time to rearrange and to start again. I could give you many examples of similar problems, which meant that time was wasted. I think initially, the GP referral meant that time was wasted. She didn't even get the GP referral because she hadn't seen a GP.
So just to interrupt, Angela, sorry to interrupt you. You said it started in 2022. That's kind of post-pandemic, isn't it? Was the pandemic part of the reason why she couldn't get to see her GP, do you think?
I think so, or other than, obviously, GP appointments are, short.
Yeah.
And therefore they continued on that same kind of system that was carried out during COVID, that they would not necessarily see people. So that was a disappointment. And obviously it was even worse that we had to pay privately and then go back to the National Health Service and say, look what this shows and need treatment. But then of course had to wait a fair amount of time before anything happened.
And is your daughter still living, Angela?
No, she died last year.
Oh, I'm so sorry. Yeah.
June.
And you'll never know whether a better, faster process might have saved her.
No, but there seem to be so many glitches on the way because of it seemed to be the communication problems between the 3 different hospitals, the hospital trusts, and she went for scans at even other hospitals as well. So nothing was joined up. It was all very disjointed.
It must have been shocking. I mean, not only to have the diagnosis, but then to find yourself in this system that obviously didn't function for your daughter, did it, in anything like the way it should have done?
No, I think it was quite shocking for her, difficult for her, because she actually was an NHS doctor herself.
Gosh, yeah.
A clinical psychologist. But of course she understood all the problems that the NHS was going through. So although it was horribly frustrating for her, she felt fairly helpless in this situation. The system just doesn't seem to work.
Do you have any advice for anyone in a similar sort of situation? You know, your daughter obviously felt there was something really wrong. Or is there nothing more that you think she or you or anyone could have done?
I think we could have been more tenacious. I think at the time we were obviously hoping it wasn't anything very serious, and therefore perhaps weren't pushing as hard as we could.
Yes, I can understand that.
And I think from treatment onwards, from the time that she was diagnosed and treated, being an NHS doctor herself, she knew the difficulties and she knew she had to be tenacious. But even with her tenacity, still, communication was very muddled. And as I said, opposing sometimes. I mean, another example was she went to another hospital for a scan, but the radiologist there wouldn't give the scan because she hadn't actually received all the information she wanted from the hospitals. It was just, fairly chaotic, not joined up, as I said.
Thanks so much for calling and sharing that with us. Thank you. What is your experience of cancer diagnosis and treatment in the NHS? Here's the number, 03700 100 444. Anne is on the line. She's in Stoke Mandeville. And tell us your story.
My husband had a cystoscopy and a biopsy of his bladder in January, and it was found in beginning of March that he had an aggressive form of bladder cancer, and he was referred to the cancer centre, our cancer centre locally, and everything started to act in slow motion at that point. He was given an appointment really quickly in mid-March, but it turned out to be the wrong clinic. Nevertheless, it was helpful because it was the first time he'd seen a doctor since he'd had the biopsy, and they explained that he needed surgery on his bladder, and that was the only thing that would cure that particular type of bladder cancer. That particular type of bladder cancer was not responsive to chemotherapy, and the gold standard treatment, their words, was to have the bladder removed. So we waited then for him to have an appointment with an appropriate doctor, but it took a month for him to be seen by the appropriate doctor. And on the first appointment, without gaining any more medical background, the doctor, I complained, and the doctor said, "Oh, well, there are many bends in the road." In other words, I guess it's not that straightforward. But he said, and he needs an MRI scan. And I was thinking, well, if he needed an MRI scan, why didn't you order it before the hospital appointment so that you would have the scan results at the time of the appointment? So he was given an appointment in May for an MRI scan and a follow-up appointment with the surgeon the day before the MRI scan, which would have been a pointless appointment. I managed to get the scan brought forward to 10 or 11 days prior to the follow-up appointment. When the follow-up appointment occurred, the surgeon still didn't have the scan results. The scan, I made my thoughts known about that situation. And then about a week or so after that, we were called by the bladder cancer nurse who said that the MRI scan had indicated that a further scan would be needed. The PET CT scan that was requested didn't take as long as the MRI scan. Things seemed to move a little more quickly. And then eventually, after another couple of weeks or so, it was decided that they would offer my husband the surgery. Unfortunately, having waited so long, all the time this was going on, my husband was having bleeds from his bladder.
Yes,
initially,
horrible. Yeah, horrible to be just left like that. Yeah.
Sporadic bleeds, and then days, excuse me, where his bladder would bleed continuously.
Terrible. I'm so sorry. What a horrible thing to happen.
We contacted our GP on a number of occasions, who reacted quickly to send him a blood test to check his hemoglobin. On the 20th of June, he was finally given the offer of surgery, which was planned for the 17th of July. Unfortunately, after that weekend of the 20th, I noticed a significant deterioration in my husband's health, and he was admitted to the local hospital with initially suspected kidney infection. But I think he was in end stage at that point, looking back.
Did he ever have his surgery, Anne? Did he ever have his surgery?
He did end up having the surgery, to my surprise, really, because he was the local hospital did their best. They gave him blood transfusion. They gave him replacement electrolytes. They did the best they could, got him transferred over to the hospital in Oxford. And he was so ill at that point, I was fully expecting the team in Oxford to say, sorry, it's inoperable because he's not well enough to undergo the surgery, because we were told, and I understand that the surgery is very high risk. He did go ahead and survived going through the surgery, but he died from complications about 4 days later.
I'm so sorry. You obviously did everything you could to be the best advocate for your husband that you possibly could, but still it didn't seem to get through. I share
the frustration with your previous caller.
Angela, yeah.
Communication is appalling in the NHS. And it frustrates me so much when I hear about the government wanting to shovel more money into the system. I've no doubt that it does need more money. It could act more efficiently without more money if it just improved communication.
And thank you so much for getting in touch with that story. I'm so sorry for what happened to you and your husband. What is your experience of cancer diagnosis and treatment in the NHS? Here's that number again, 03700 100 444, or you can message us to you and yours at bbc.co.uk or text us to 84844. I should say we're having some positive messages coming in as well. This one from Paula in London. I was diagnosed with breast cancer in August, saw my GP the day I phoned with a suspected lump, had surgery in September at the Royal Marsden. Now 6 weeks later I'm back running, swimming, I'm feeling pretty good. I have had fantastic care both from Kingston Hospital and the Royal Marsden. I could not have had better care from my GP or from those hospitals. Edward in Skipton, I was 62, diagnosed with bowel cancer through a routine screening in July, had radiotherapy in October. Last Tuesday I got the all clear at all levels. Everyone who dealt with me was fantastic. Jacqueline in Bristol, I had breast cancer from 1922 to 23, had a really good experience in the NHS. The surgeon did an operation within 6 weeks and it was even brought forward for a few days. So thank you for those. Obviously these distressing stories about delays are not the whole story. The number of people surviving cancer has improved hugely in the past 50 years, but speed is crucial. for your prognosis. And there's some research today from the BBC's health team into how the different health trusts in England are performing against their targets for diagnosing and treating cancer. Chloe Hayward is a BBC health reporter. She can tell us all about the research. Hi, Chloe.
Morning.
So there's a key waiting time target, isn't there, in cancer care, that patients should start treatment within 62 days, roughly 2 months, of an urgent referral for suspected cancer. Tell us overall then, how are the hospital trusts in England performing against that target?
So the 62-day target is the gold standard. So from that moment, the GP gives you an urgent referral to go and get diagnosed or checked whether you have cancer or not, if they suspect you have it. And in that time, you've got the 28-day target where you're hopefully told you either have cancer or you do not, so you're given your diagnosis. And then after that, it's the from point of diagnosis to starting treatment. And that's meant to happen within 31 days. So the total pathway is this 62-day sort of gold standard target. And they say 85% of patients should hit that 62-day target. We did an analysis on this, and we found that instead of lots of trusts hitting this, it was actually only 3 trusts out of 121 that were hitting this 62-day gold standard target. And as we know, its speed is really important. There's a lot of research around it and strong evidence that for every 4-week delay in treatment starting, there's a 10% reduction on average in survival rates.
There are 2 parts to hitting the target, aren't there? The speed of the diagnosis and the speed of the treatment. Where are the delays? So
as I mentioned, there's that 28-day part of the pathway and the 31-day part of the pathway, so the diagnosis and the treatment parts. And the delays come throughout. So actually, it's so true, the stuff that your callers Angela and Anne were both saying. Communication, it's making every day count in those pathways, which is crucial. So we filmed at 2 different hospitals, the Lister Hospital, which is one of the ones that was hitting this 62-day target, and we filmed another one, the Royal Free, which is not. And both hospitals have incredible surgeons doing incredible things and wonderful doctors doing very, very specialist and complex stuff. But it's this communication is something that does come up quite a lot. It's this ability to do the teamwork. So an example at Lister, we met a gentleman called Paul. He'd been diagnosed with prostate cancer a couple of weeks before we got there. He was in the day before his surgery was happening on a Saturday. So he had the Saturday surgery, but also the day he was diagnosed, he was told his diagnosis in the morning, and in the afternoon he met the oncologist and then he met the surgeon. So by the end of that day, he had been diagnosed and had his surgery booked in. He'd made his mind up, he'd made a decision, he'd had the meetings to understand what his options were, and then had it booked in.
All in a day, it's fantastic.
All in one day,
yeah.
And that's example. So it's not because the Lister had lots more money or because the Lister had any different machines. It had robotic surgery machines, the same as the Royal Free. But in other hospitals, not necessarily saying it's the Royal Free, but many other hospitals, you have examples of patients going in, getting their diagnosis one day, 2 weeks later having the appointment with the surgeon, 2 weeks after that having the appointment with the oncologist. Yeah. And this all feeds into these massive delays. And there's another element as well that we saw when we were doing this filming was also these surgical theatres. They're very specialist, they're very complex, and they're very expensive. They also have a lot of very specialist staff in them. But we had one example where we were filming a robotic surgery of a kidney tumor being removed. And I said to them, what about yesterday? And they said, yesterday, actually, the theatre sat empty for some of the time. And I was like, gosh, why? And it said, well, the patient didn't turn up. They didn't get their letter confirming the surgery. Gosh. And you kind of think, again, it's very, say, basic. It's that communication, it's that joined up thinking, it's that teamwork, which actually is making a lot of difference when it comes to hitting these targets.
So you were looking at what was happening in, as you say, 121 hospital trusts across England. How does England compare with the rest of the UK? So
sadly, all the nations are doing badly. So England, the target in England for the 62-day is 85%. On average, that is 68.9%. So we're well below. In Scotland, their target is higher at 95%, but they are hitting 71%, so slightly higher than England, but not much, still far below the target. Wales, it's 60.6%. So again, well below any target, below England and Scotland when it comes to hitting that 62-day target. And in Northern Ireland, sadly, the situation is far lower. Only 33% of cancer patients.
That's extraordinary, isn't it?
33% of cancer patients will be getting treatment started within 62 days.
That's extraordinary, the Northern Ireland figure. I saw that on the website. There is a tool, isn't there, embedded in the news story on the BBC News Online website where you can look at how your own local health trust compares. Tell us about that.
Yeah, so hopefully we're hoping that audience will come online and read the story, but also they can use this. They can type in the name of their local trust and it will pop up immediately how their trust is doing. So it will say whether their trust is hitting that 28-day target. It will say whether their trust is hitting that 31-day target. And it will also say whether how their trust is doing on that 62-day gold standard target. We've ranked the trust by that 62-day target as well, just to give you an idea of where your trust stands. Because if you see your trust miss the target, you might go, oh my goodness, it's appalling. But actually, it could be number 4 because all the trusts other than 3 are missing that 62-day target. But with it as well, we've shown sort of different tools so you can really understand what this means, because there are a lot of trusts that are in that middle territory. So I don't want to have a situation where patients will see that their trust is sort of at 75 and another one next door is at 45 and think they must shift, because actually often between those middle ranks there isn't a huge amount of difference.
It's really interesting, really easy to use. I did it from where I live this morning. Tell us, what does the NHS have to say about what you found?
So the NHS, they are very much doing lots. They are trying to bring in innovations. There's a lot of talk about new machines and understanding just how complex this process is. So when I was talking to the Royal Free, they are doing a lot to improve. Our analysis was over 12 months, but the Royal Free is one example where over the last 3 months, they've really done well. Another place, the Isle of Wight, they've really improved over the last 3 months as they stood back, realised where the problems are and looked at their flow, their workflow to see how they can make sure there's no dead space in that pathway. But a lot of them are aware that it's age of machine is causing a problem. An older machine is a less reliable machine when it comes to MRIs or when it comes to radiotherapy. And the government has also said, so back in July, the government announced their 10-year health plan. They said that cancer was a core priority and the new cancer plan is expected. It was expected end of this year. It now looks like it's going to be into early next year. And they are saying it is as a priority, and they're doing lots in terms of community diagnostic centres and new innovations that will increase capacity and hopefully speed up things. But there's an awareness that more needs to be done across the board.
Chloe Hayward, BBC Health reporter, thank you. We're going to be hearing more about improved cancer survival rates and treatments a bit later on from the charity Macmillan. We've got Macmillan's lead advisor, Dr Anthony Cunliffe, with us today. What is your experience of cancer diagnosis and treatment in the NHS? Please give us a call, 03700 100 444. Let me go back to our callers now. We have Joe Williams on the line, who is in Buxton. Joe, I think yours is a good news story. Tell us what happened to you.
Hi, yes,
Hi.
I was really sorry to hear about the previous caller.
Yes, a sad story.
It's really sad. So I was diagnosed with breast cancer in March, and then I went on my treatment started in April, and was a very
So that's
clear
very
pathway.
fast, isn't it? March to April. Yeah.
Yeah, it's really good. And obviously, I was Christie, so the Christie is a fantastic hospital. But the Christie also has a kind of hasn't outpatients, but the Christie is in Manchester, but they also have a building in Macclesfield, which is nearer to where I am. So there's Macclesfield General Hospital. So that was the breast clinic was there, but then there was the Christie that was doing all the cancer treatment. So that kind of, it worked really well for me. And there was a very clear pathway, and I felt like, I felt people, knew what needed to be done at the time. So yeah, it worked well for me.
How are you feeling now?
Okay, I haven't finished yet. Still got radiotherapy to go, which is in the same place. So I haven't finished the treatment yet. But yes, I'm feeling quite good. And after what was quite a scary time.
I bet. Thank you for getting in touch, Joe. Thanks, and good, very best of luck to you. Grant Perry's in Croydon. Grant, I know that you were diagnosed with mouth cancer in 2017. Tell us what has happened with you since then.
Hi, Winifred. Yes,
Hi.
well, first of all, I would like to say that the way I was diagnosed was through my dentist. My NHS dentist, I went for a routine checkup, and he started feeling around my neck and said, there's a lump here I'm not happy with, I'm going to send you for some tests. So if I hadn't gone to my dentist, if I wasn't lucky enough to have an NHS dentist, I wouldn't have been diagnosed for, I have no idea how long, because I wasn't in any pain. So I was referred to the local hospital within weeks. I went for a couple of tests there. They verified that I had cancer of the mouth. And from then on, it was just so smooth. I mean, I feel a bit guilty having heard your two previous very sad callers.
It's sort of survivor's guilt, I suppose.
It is a bit, because everything just sort of kicked in like a well-oiled machine from my point of view. I was referred to the Royal Marsden up in Chelsea, and I went for 6 weeks of radiotherapy, 3 sessions of chemotherapy, and followed, by the numerous checkups again at my local hospital afterwards. And I think it was last year or the year before I was told as far as they were concerned, I was in the clear now.
Oh, that's fantastic.
I can't fault them, but I say I'm very well aware that it doesn't run quite so smooth for other people.
But
I do wonder whether that's just because I'm a Londoner, because possibly we have better facilities in London.
Well, you can go online, Grant, and have a look. If you go to the BBC News website, you can put in where you live, and they will find the trust for you. You can see how your trust, you were saying this happened to you in 2017, how it is doing now. It's really interesting.
Yes.
Grant, thanks so much for that. Thank you. What is your experience of cancer diagnosis and treatment in the NHS? Here's the number to call: 03700 100 444. Let me bring in Alan Rice. He is in Dumfries and Galloway. Alan, tell us about your cancer diagnosis and what's happened to you since.
Well, I started off with stomach pains back in 2004, the 24, and I was being treated for that. It was actually getting worse and worse. In the new year, it got to the point where I had a CT scan booked in for that, and I was being sick a lot and not eating very well.
Yeah.
And so I was actually admitted to hospital before the CT scan, and I was then diagnosed with pancreatic cancer, and that was in the Dumfries infirmary. And the treatment I had there was very good. In fact, one of the doctors that saw me was a professor. I was then moved up to Edinburgh to sort out treatment and so on. And the cancer had, I would imagine, wrapped around the duodenum, so it was blocking off the duodenum.
Sorry, you may have already said, Alan, what kind of cancer is it that you have?
Pancreatic.
I see.
Pancreatic.
Yeah.
And so I had to have a bypass for the duodenum, a bypass for the various liquids to go through.
It sounds like you've really been through the mill.
Well, yes, and while I was in Dumfries Hospital, my wife fell over and broke her arm.
Oh, that's what happens, isn't it? This never rains but it pours.
It does, yes.
Yeah. Oh, gosh, what a time you have had.
But I found with that, people were so helpful with it.
What has your treatment been like?
I can't. It's inoperable, and it's advised not to have chemotherapy because it wouldn't increase my life that much, and I'd have all the upset of the chemotherapy.
Yes, it would just make you feel sicker.
That's right.
Yeah.
And one of the other things that happened was when I was in Edinburgh. It was a four-bed ward, I think it was. 4-bed ward. And I got influenza.
Oh, gosh, goodness me.
It doesn't rain, it pours,
How are you coping now, Alan?
Well, once I got the diagnosis and the prognosis, I decided at that point to try and keep as normal as possible.
Yeah.
Go out if we can, and go to places and etc. It also gave me time to sort out all the paperwork that comes with somebody dying.
So that's something you've been able to do for your wife, so she won't have to do it.
That's right.
Yeah,
yes.
Yeah. Well done.
And certainly, if somebody has had a prognosis of that it's terminal, the one thing that should be, that's one thing that you should do, including sorting out what you want for your funeral arrangements.
Yes, absolutely. It will make people feel better, won't it, who are left behind?
In fact, people who haven't had that, people can die suddenly, and the partner has no idea what they want.
Well, thank you
that often happens.
Thanks so much for getting in touch with us, Alan. That's really kind of you. Thank you. We really appreciate it.
Right.
Thank you. What's your experience of cancer diagnosis and treatment in the NHS? Here's the number: 03700 100 444. I want to bring in Angeline Noble now, because she is in Belfast, and we were just hearing from our health correspondent Chloe Hayward that Northern Ireland across the UK does the worst in failing to meet this target that you should start your treatment within 62 days of an urgent referral. Angelina, tell us what has happened with you.
Good morning, Winifred,
Hi.
and thank you very much for having me on the show and allowing me to tell my story.
No, thank you for getting in touch.
My story began back in January time. I started getting horrendous pains in my back, and I assumed it was a urinary infection. And, I contacted the doctor and they concurred and they prescribed me antibiotics. And then over time, it just kept reoccurring over and over and over again. I'd phone the doctors. You couldn't get an appointment. Everybody wants to diagnose you over the phone. I was prescribed, antibiotics on every occasion. And, eventually you kind of get to the stage where you think it's got to be more than this because it's just not going.
How long did this go on for, Angeline?
This went on for This went on for about about 3 months.
Yeah, you felt ill for 3 months and you were being given antibiotics.
Yes, and in that time period, I also had 3 trips to A&E. So on one of the occasions, I do have to say, when I was down at the doctor's, one of the doctors phoned me up and said, we've tested your urine, there is no infection, so there's something not right. So I did actually go down, and they examined me, and they thought it might be appendicitis. So they said to me, go up to A&E, and my heart sank because I thought this would be the second trip. I waited 12 hours before and was just dismissed as, probably it's nothing, just go home. The second time, whenever I went out with a letter from the doctor, the doctor had taken time, he'd written the letter. I'd gone up, the nurse, whenever she admitted me, she said, just ignore the letter, just tell me in your own words what's wrong with you. And the same thing happened. I was dismissed, but this time I stood my ground and said, the doctor wants me to have a CT scan. So like a lot of conversations, and I waited for another hour. Then they came back and said to me, yes, you can have a CT scan, but you'll have to come up on Saturday morning. So I went up on a Saturday morning and brought my sister with me, thank goodness, otherwise I think I'm going mad. Did the CT scan, and I kept saying now, whenever we were reviewing it, there's nothing sinister, everything's fine. As casually as anything, he was like, you look so healthy, the scan is brilliant, there's nothing to see here. So that was fine, I left quite happy. And then it just came back again, and it was even more severe. So I just said to my husband on the Saturday morning, bring me up to A&E again. I'm just going to dig in for the long haul. So again, I was up there. I seen a doctor who would have been my sort of age. He actually listened. He had empathy. He ran tests, and then he said, I want to admit you because there's something not right with your liver function. So I got admitted to the Royal Victoria Hospital, to my bed in the corridor. So I was in the corridor of the ward for about a week.
Oh, gosh, a week in a corridor.
I do have to say that the 2 consultants that I've seen up there, Mr. Turner and Mr. Hunter, were absolutely, they were very empathetic, and they ran tests and they did everything.
And what was wrong with you, Angeline?
Well, what I've actually been diagnosed with is I actually am a BRCA gene carrier. So, even having the BRCA gene, obviously you recognise you have a very high potential to suffer with breast cancer, which I've had. I've had a double mastectomy. Yeah. I've also had my fallopian tubes and my ovaries removed, all as preventative measures.
Yes.
So, even I think the doctors should have thought to themselves, in her notes, she's a BRCA gene carrier. Her mother died of ovarian cancer. It's a genetic thing in the family, but it's almost like there's nothing joined up. Nobody takes the time to actually look at notes, or maybe take a breath and think, you know what, maybe we should take this a little bit more seriously.
So what was it, Angeline? What is it that you had?
What I was diagnosed with, it's actually quite, as they said to me, it's bad luck, but it's as a result of the BRCA gene. I had cancer of the stomach lining. It's called peritoneal cancer.
Gosh.
And I have been going through chemotherapy up at the City Cancer Care, which I do have to say, once you're in the system, my treatment has been excellent. I cannot speak highly enough. And then recently I've had pretty major surgery, to remove any of the cancerous tumours, and then I'm finishing my chemo. So I think only that I was diligent.
Yes, you fought.
I'm not a very assertive. Well, I don't think I'm particularly assertive when it comes to medical matters, because
it's
I feel
scary,
it's not my area.
And it's scary, isn't it, when you think of the people who are not assertive or who have no advocate? What happens to them?
Well, I agree, and that was the one thing I kept saying whenever I was admitted to the ward. Whenever they wanted to release me, they wanted me to come back in then to have biopsies, and I just kept saying, please don't, I'll get lost in the system. I have no faith in the system. I don't trust the system, to the extent that the specialist said, here's my assistant, this is her name, you call her, we will not lose you in the system. And, I ultimately had to trust them at that stage, but that's a very, very difficult transition after you've been through months of being fobbed off, not seen, diagnosed over the phone, told things that were incorrect. It's very, very difficult. And I would say a lesser person, and only that my family were there to support me, to say, no, you've got to go back, you've got to get this sorted. But I've actually found myself in a situation where my prognosis actually looks quite positive now.
Well done you.
I'd hate to think. I sometimes think that the nicer you are and the more accommodating, the more you just get looked over. You know, when you're in situations with the doctors or in an A&E situation, sometimes I think it's those that are loudest or disruptive that get seen, and it's very difficult, I know, for people. But like I say, I think once you're in the system, well, certainly from my perspective, I can't speak highly enough of the cancer care team up at Belfast City, and that my treatment has been outstanding.
Angeline,
once I got there.
Thanks so much, and well done. Thank you for that.
Thank you for listening.
Dr Anthony Cunliffe is a GP in South London, but he's also the National Lead Medical Advisor for the charity Macmillan. Dr Cunliffe, what do you make of the BBC data released today? You know, that cancer treatment targets are not being met. Northern Ireland, for example, falling far, far short.
Yeah, and before I come to that, I just want to refer to the people who've been brave enough to come in and tell their stories today, and just highlight that a few of the things we heard: the need to be tenacious, the need to be assertive, perhaps the need to feel you need to complain. And these aren't things we want to be hearing from people, because we should have an equitable cancer services in the UK, and we shouldn't be relying on individuals themselves. Although we want people affected by cancer to feel empowered and to feel supported, we shouldn't be relying on them to be tenacious and assertive to get through these cancer pathways in appropriate time. So I just wanted to thank the speakers for coming on, really. Regarding the reports of the cancer waiting times not being met, really important for that information to be out there. Unfortunately, it isn't surprising, and for many years now the health service is under immense pressure, and many systems have struggled to meet these cancer waiting times for a long time, and it is concerning. And it's great that you refer to the tools so people can go on and look at the different performances in different hospitals. Although, obviously, what we want is an equitable health service, and we don't want people to need to be trying to find a hospital that might have better waiting times, and because that means they have to travel to there, which obviously for a lot of people is very difficult. And we're really encouraged that the current government is committed to achieving cancer waiting times by the end of this Parliament, and organisations like ourselves at Macmillan Cancer Support need to work with them to do that. We do need all to collaborate to try and achieve these difficult targets.
Just before I go back to the callers, because we haven't got a lot of time left, the overall story about cancer treatment in the UK is a good one, isn't it? Would you tell us briefly what has improved?
Yeah, it's really important that we cover that, and it's great to hear some of the good stories that we heard today, because we do know that most people do have a good experience, and what we don't want these more concerning experiences to do is to prevent people going to the doctor if they're concerned about cancer. We need people to present early, because that is when the chances of cure or better outcomes are highest. We have seen a lot of improvements across the NHS. Certainly there's a lot of positive stories about innovation. We heard a lot of things about communication and hospital appointment problems, and we do know that technology in innovation is going to help us with these specific areas, and we're hearing great stories. But what we've got to do as the government, as the NHS, as organisations like Macmillan, is help spread and adopt these good stories so that everyone is getting that experience, and not just people in pockets of the UK.
Dr Anthony Cunliffe, thanks for the minute. I will come back to you. Let me bring in Wendy in Watford. Wendy, I know that you, like some of our other listeners, you had a bad experience with communication when you discovered that you had cancer. Tell us about that.
I did, yeah. I'd first like to say that every individual I dealt with, or dealt with me, was wonderful. But the whole cohesion of the experience was just horrendous. I had 8 weeks before I actually saw a consultant on Cancer Fast Track. So I was told I had primary liver cancer. I didn't have primary liver cancer. But some of the things that were a problem, for example, I had to have a lot of MRI scans. And the MRI scans were often booked before I saw the consultant. And I'd phone them up and I'd say, look, shouldn't we have the MRI first? I remember one occasion where the lady said to me, oh, yeah, OK. And then she booked it for the following week. And I actually said to her, I think it's 10 days for the MRI results. Oh, it'll be all right, she said. And then when I went to see the consultant on what was supposed to be, finally, after a horrendous journey, my discharge appointment, he said, well, you haven't had your MRI yet. And I said, I have. And he was so frustrated. And he apologised to me for the bumpy journey that I'd had, because the diagnosis was wrong. They had scheduled me for surgery when I didn't actually have cancer, based on some very poor tests, which were eventually redone.
What was wrong with you, Wendy? What was wrong with you?
I had a thing called focal nodule hyperplasia, which I probably had for 40 years. So the guy who did initially it was very quick. My liver enzymes were raised. My GP was concerned. Within a week, I'd had an MRI and a liver biopsy. But the MRI, I was told later, was very fuzzy, so not very diagnostic. And the guy that did the liver biopsy kept saying, I'm not sure I can do this. It's awfully close to your kidneys. And then he was asking me why I was breathing fast. It's because I was petrified.
Pain, yes.
And he gave me the lidocaine, and then he did the biopsy almost straight away, and I was like I'd been stabbed.
Yes, horrible. Yeah.
And then I was referred to a drug trial, and I said, I don't want the drug trial, I just want this out of me. My family history is that my eldest son died around Christmas time, and this was Christmas time.
Gosh, I'm
and
so
I have
sorry.
2 surviving children.
Yes.
And I didn't want to do drug trial, I just wanted to survive.
Yes.
And the drug trial people phoned me up the next day after that. I'd been scheduled to have a quarter of my liver removed in about a week's time. And the drug trial people said, well, we don't understand why you don't want to try the drug trial. And what the consultant hadn't told me, and the drug trial people told me over the phone, just before Christmas with my family in the house, was that my risk of death was 70%.
Gosh, yeah.
If I didn't have the drug trial.
Oh, gosh.
And the drug trial was reducing the risk tremendously. So I was told over the phone that I was probably dying.
Yeah,
They repeated all the tests, and actually I didn't have cancer.
Well, I'm so glad to hear that.
The initial tests weren't done very well. But for 8 weeks, the only person that I had to talk to was this lovely clinical assistant. She was not medical. She was just not a secretary. That's not the right word. And I do apologise if she's listening because I don't know what her title was. But I don't know. She must have been run off her feet. And she would always get back to me within about 48 hours. But from the initial biopsy to first seeing a consultant was 7 weeks.
Yes, yeah.
During which time I had no one to talk to about what was wrong with me.
That's horrible. Yeah, what a horrible thing.
The GP didn't know. I didn't have a consultant. Nobody was giving me any help. And what this consultant said to me, which I thought was very interesting, which is why I called, when I went for the last appointment, and he rolled his eyes and said, I'm going to have to rebook your appointment because you don't have your MRI results yet.
Yeah.
Was we do need more doctors and nurses, but what we need is more clinical staff, not clinical staff, admin people who are properly trained and know what they're doing. And I'm wondering how many times that happens. That wasted appointment probably cost the NHS 300 quid, whatever, because it was a consultant, not even the registrar. How many missed appointments or messed up appointments are made because of the admin?
Wendy, thanks so much for getting in touch. I'm just going to stop you. I just want to get at least one more caller in, but thank you so much for sharing that horrible story with us, and I'm glad that you got through it. Phil Denman is in Kent, and he's been hanging on for a long time. Phil, I think that yours is a good news story about a swift diagnosis of prostate cancer. Tell us what happened to you.
Yeah. Hi, Winifred. Yes, it was absolutely brilliant. I was having lunch with a very old friend of mine back in November 22, and he said, have you had a PSA test? And of course I said, what's a PSA test? And he explained, and he in fact was going through issues with prostate problems. So I, that afternoon, called my surgery. The doctor was very quick, left me a blood form out the following day, and I went and had the blood test done straight away. The following day again, the doctor phoned me and said, your PSA is high. I'm going to get a consultant to call you, and they'll take it from there. So within 2 days, the consultant phoned me and said, right, we're going to get you an MRI scan. And that happened, I think, within a week. And I had the MRI scan, and the local hospital called me in and said, we'd like to see you for an appointment to discuss the results. And unfortunately, the results were that I had prostate cancer. But luckily, it was contained within the prostate.
Because you had no idea you had it. You had no symptoms. A friend researched you to have the test.
Yeah. So I then said, well, okay, where do we go from here? And they said, well, there are two options, surgery or chemotherapy. So I went to see both the surgeon and the oncologist and discussed the matter fully with them. They gave me some documentation. And then I was allowed to decide which was the best, which method I preferred. So I said, let's go for surgery. That was in December. And I had an operation set up for sort of end of February the following year. So just a couple of months later.
How are you now? How are you now, Phil?
Brilliant.
Good. And you're completely recovered?
Absolutely, yeah. No, it was just absolutely brilliant. So I feel so sad for all the people you've had on the show that have had such a horrible experience.
Well, there's another good experience coming, a similar experience to your own, Phil. Richard Mann in Cornwall. A similar thing happened to you, no symptoms, but it turned out that you had prostate cancer.
Hi, yes. No symptoms at all. I was in the process of raising money for a friend of mine who had died of prostate cancer, and I'm a performing poet. And I thought that if I'm raising money and urging people to have the test, I should have the test myself. And within a fortnight, I was seen, and I have had chemotherapy And no, I haven't had chemotherapy, I had radiotherapy. And the various searches were pretty painful. But now I've had the PSA had plummeted down from sort of high 81 to 0.02. And this is all due to the medication. And I cannot speak highly enough of the Sunrise Centre at Truro Disc Hospital.
Thanks, Alex, and thanks, Richard Mann. Dr. Anthony Cunliffe from the charity Macmillan. Just before we leave it, you're a GP, and you must be regularly telling people that they have cancer, because 1 in 2 of us will get a diagnosis of cancer, won't we, in our lifetime. Everyone's different, their circumstances are different. Is there something that you always say to people, a piece of advice that you always give?
Yeah, I mean, patients know the body's best, absolutely. And I know that people can have challenges in getting GP appointments, and that might cause barriers to them presenting, but we do want people to report any persistent changes in the body, whatever that might be. Certainly anything that's unusual for you that's lasting more than a few weeks, we want you to present to your GP or another primary care healthcare professional and explain your concerns, and perhaps be explicit that you might even be concerned about cancer, because we definitely want to see you and get you in the system as early as possible. So we know that people can have challenges to see the GP, but it's a really, really clear message. Be aware of your own body, and any persistent changes, make sure you present. And we heard a couple of comments there about prostate cancer. We don't have a prostate cancer screening program in this country, but we do have screening programs for bowel cancer and cervical cancer and breast cancer, and we know that people who are diagnosed through the screening programs are more likely to be diagnosed earlier. So again, we also want to encourage people to take up those screening program opportunities so that we can help them get diagnosed, because often in those situations people won't have any symptoms at all. And I do just want to refer to something we've heard from some of your speakers as well. We can focus on the length around cancer waiting times, but we know that even 62 days is a long way to wait when
yes,
you're
it is. It's 2 months.
diagnosis.
Yeah, I know, it's extraordinary when you see that's the target, and
Absolutely.
It's not being met, because if it was you waiting 2 months, that would be one horrible 2 months of uncertainty.
Yeah, and what we know is that we know that there is potential, and certainly in some cancers, for things to progress in that amount of time. But what we definitely know that for everybody, even though everybody's experience of cancer is unique, we know that everybody can have other impacts during that time. Certainly psychological impacts, just the stress of waiting for that diagnosis and being unsure about options, etc. We know that socially it can really impact people. Lots of appointments can really impact on their ability to work. Some people have to travel a long way to get these tests as well. So we know that the impacts are way beyond the physical, and we really want to encourage people to seek out what support's available for them when they're going through that time as well. And certainly at Macmillan Cancer Support, we have our support line, we have our online community, but also I would, as a GP, would encourage people to speak to the GP as well.
Thank you so much, Dr. Anthony Cunliffe, who's speaking on behalf of Macmillan, and thanks everyone who got in touch with us and called and wrote